Good evening, and thank you for joining us for this virtual community town hall addressing COVID-19 in the Fredericksburg region. Mary Washington Healthcare is committed to improving the health of the people in our community. We take this commitment seriously and know the COVID-19 pandemic continues to raise many questions and concerns for you and your family. Tonight, we are here to share what we know about COVID-19 and what we are doing to keep you safe and healthy. During this town hall, you will hear from our expert panel, and we welcome you to ask questions in the chat during the conversation. Let's meet our panelists. First, we have Dr. Mike McDermott, Chief Executive Officer for Mary Washington Healthcare. Second, we have Eileen Dohmann, Chief Nursing Officer for Mary Washington Healthcare. And third is Dr. Christopher Newman, Chief Medical Officer and Chief Operating Officer for Mary Washington Healthcare. Dr. McDermott, I'd like to turn it over to you tonight to start the program and tell our viewers the latest information regarding our district.
All right, well, good evening, everybody, and thanks again for taking just a little bit of time out of your evening to join us to learn about what's happening with COVID-19, especially here in our Fredericksburg region. I'll start with some of our graphics from our dashboards that we use internally. We currently have 61 hospitalized inpatients that we're treating that need hospital care to help them battle COVID-19. We've been just over that 60 number pretty much all week this week. I think we peaked at 64, but it's been up and down since there. On that graphic that we show every time that we meet, remember the yellow line is our number of hospitalized patients that we've had with COVID-19, really from all the way at the beginning of the pandemic on the left, moving all the way to the right to today. And it's that curve that we're on from November 1st until now. You see the steepness of that curve that causes us to start these town halls again to raise awareness with our community that, hey, these curves are unsustainable and the prevalence of COVID-19 in our community is higher than it's ever been. The orange line is also the number of hospitalized patients in the state, which also is on a dramatic increasing slope. And we need to start taking those steps again as a community to flatten the curve. You know, we have it's a sobering time right now, and we need to accept reality for what it is. And the facts are that every single day we are setting records at a local level, at a state level, and at a national level for the number of new cases of COVID-19 diagnosed, the number of hospitalized patients that need hospital care for COVID-19, and the number of deaths from COVID-19. New records every single day. And that is a sobering time. And I think it is that data-driven approach that has had our governor today at his press conference announce new tactics at the state level in an executive order. And I think those are welcome messages from the governor. Those include an expanded stay-at-home order. It's that same message we've been talking about over the past couple of weeks. Stay at home. Don't go outside your home if you don't have to. And so this expanded stay-at-home order is a great tactic, and it's one we should all keep in mind. We should stay at home in our households if at all possible. There's also an expanded mask mandate as part of the governor's new executive order, including in indoor environments where there's anyone outside of your daily household present, right? You should be wearing a mask. Also, outdoors, if distancing isn't appropriate, wear a mask. And we've been reinforcing that message on our town halls here for the last couple of weeks. Wear a mask at all times. As a good example, it protects you and the others around you. There's also, I think, new limits on public and private gatherings and a reduction in the number of those from 25 to 10 people. I encourage everybody, don't even have a gathering of 10 people, right? That's really not safe at this time when we're setting these new records every single day. You know, the director of the CDC today was talking, and he had noted that COVID-19 now has surpassed heart disease as the #1 cause of death in our country every day. That is a sobering fact, and we need to accept that reality that we're in right now. I know we've been dealing with this virus really for an entire year, right? And it's become part of everybody's lives. But we need to accept the reality that it's never been more dangerous than it is now because of how prevalent it is in our community, in the state, and in the nation. And it's that prevalence that really all of us should rise to the occasion and say we're going to be more vigilant than ever. And so I'll just start my message today with that message of increasing vigilance, accept reality for what it is today. Now is the time to take action.
Thank you, Dr. McDermott. Eileen, given the numbers that we're seeing on the slide that Mike shared with us a few minutes ago, how are we doing with capacity and staffing here at Mary Washington Healthcare?
We're busy. We've seen a busy fall, not with COVID, with other sick patients coming to our hospitals, but we're within our capacity, and so we're managing and always wanting to be here for our community when they need us. Our staff is extremely resilient, and so they are very committed to caring for our community, as they always are. They are tired at times. They have been heroes. The stepping up again and again to make sure that they are here for our community. We've seen some increase in our ICU census, not COVID. Actually, I've seen some larger numbers that are outside of COVID. So it's been a busy fall as far as our census goes, but we're within our physical capacity of taking care of patients. I think the most alarming thing when we see this uptick in the month of November is that line can't continue that way. Because we do then, start looking at saying, now suddenly, saying, well, what could happen if we got to capacity? We don't want to get there. And it's also very, challenging and difficult when we know that we could bend that curve. We could make the change, that if we all came together, just like we did back in the spring, we could change that trajectory. And that's really what I think, on behalf of all of our healthcare heroes that are in our hospitals, that would be what they would say to our community, is bend the curve. Seeing people that are sick with COVID, this is not a gamble that you want to take, and why put yourself through that or your loved ones. And so we can do something about this. We can bend the curve by doing the precautions that Mike talked about. We're well within our capacity in our hospitals, and we want to make sure that we are always able to care for our community, but these numbers are concerning.
Thank you, Eileen. And Dr. Newman, I'd like to talk with you about some new treatment that's in the market. We talked a little bit about it last week, but monoclonal antibodies is something that we're hearing a lot about in the news and hearing more and more that there is availability. Can you explain to the viewers what that is?
Yeah, the monoclonal antibodies kind of help your body's immune system. They're designed to sort of help your body's immune system attack the COVID virus and clear it from your body at the early stages. So not once the disease is already advanced to where you're sick enough to need to be in the hospital or require oxygen, but really for high-risk individuals to prevent the progression of the illness to that point. So it really works, it boosts your body's immune system to attack COVID and clear the body of COVID. It is an intravenous medication that's given in an infusion over the course of an hour. And we are infusing that both at Mary Washington Hospital as well as at Stafford Hospital. And we've had many successful treatments over the last week as we have started this. And I like to think of these medications as each medication could prevent somebody from having to be hospitalized. It not only helps that one individual, but it takes that strain off our entire healthcare system and allows the healthcare system to be within its capacity to care for everybody who may need care here at the hospital. So again, financial concerns should not be part of this. We are receiving this medication from the state. So there are ways that we can help with the funding of this. So even if you're uninsured, we do not want that to dissuade people from pursuing this treatment if it is necessary for them. Another important point is how do I get this medication? I get sick, I get a positive COVID test. Within 3 days of that positive COVID test, if you're one of the high-risk categories, and that's such things such as age over 65 or diabetes, age over 55 with obesity. So it's very common things. If you do think you're in one of those risk categories, contact your primary care doctor. We've sent messaging out to all the primary care docs and urgent cares throughout the region, so they know how to get you scheduled here for this medication, very expeditiously. The other, if you don't have a primary care doctor and you don't have insurance, we have 2 urgent cares that will see you. We will see you and we will help facilitate this. We have an urgent care in King George and we have an urgent care in Stafford. and we will be happy to help facilitate this. So that should not be an obstacle.
Thank you for that. We're already seeing questions coming in about vaccines. It's something we wanted to talk a little bit about tonight. Dr. Newman, what's the update on vaccines here in our community?
Yeah, so the panel has been deliberating on this vaccine right now for the FDA. We are expecting a positive outcome by the FDA with an emergency use authorization. Not sure if it'll be tonight, but by tomorrow, hopefully, we will know. We are expecting shipment of vaccine in our community here first thing next week. So very, very happy. It's great news. This is a ray of optimism and sunshine in this very gloomy and difficult year. So there is reason for hope on the immediate horizon. Here at the healthcare system, we're expecting somewhere just under 2,000 vaccines. The first round of vaccines are going to high-risk healthcare workers. That is as outlined by the state. We are following the state prioritization list that has come out, and we will be following that throughout. We're expecting more doses in the upcoming weeks, not only of Pfizer, but if Moderna's vaccine in the next week gets an emergency use authorization, that will be there as well. Other very high priorities will be the skilled nursing facilities and assisted living facilities that have been hit so hard by COVID. So they will be also getting vaccinated. Mary Washington Healthcare has agreed to really work with our community to be the source of vaccination. So I had discussions with the Virginia Department of Health yesterday, and we are making plans as the vaccine begins to roll out to help coordinate and facilitate that so that people can get it. So this will be rolling out first through healthcare providers over the next couple weeks, both here at our health system as well as out in the community. We'll be working first responders, essential workers, high-risk individuals. Those will be some of the first rounds, and then eventually everyone.
And one of the questions that did come in was, how long do we think it'll be before people over 60, 65 will be in line to receive that vaccination?
I can't answer that with certainty, but I do think that probably end of January, early February, something to that time frame. I think we'll be able to start getting more broad vaccination. The federal government has committed to have everyone vaccinated or that wants to be vaccinated by June 1st. And we have to remember both of the vaccine candidates are 2-dose vaccines. So the Pfizer vaccine that we're getting now is 21 days apart. And by day 28, so a week after your second dose, you're felt to be immune. And again, we'll see what the formal ruling from the FDA comes out. But the preliminary data that we have is over 90% efficacy, which is fantastic news and a very good safety profile on these medications with just very mild symptoms with the vaccines. So we're optimistic.
Thank you. I'd like to jump to our community questions for the panelists. The first question that's come in is, are we planning to cancel any surgeries or elective or scheduled procedures that require an inpatient stay?
So we are not planning to blanket cancel elective and scheduled procedures like we did before. One of the big stress points when we did that before was PPE. And we did not want to be diverting gloves and gowns and all those things for elective procedures from the COVID units in the ICUs. At this point, we do appear to have an adequate supply at this point. So we're not looking to delay a lot of those. As our ICU is at capacity, we do look at occasionally cases here or there that may be able to be delayed a week or so safely in order to keep things within our capacity to care for everyone here in our health system. But that's on an individual basis. It's being looked at regularly by our medical staff leadership and surgical leadership, and we're looking at that. But we're really trying to avoid cancellation of scheduled procedures because it has led to poor health outcomes for individuals. And I just want to continue to stress, when you hear, oh, COVID rates are rising in our community, they're rising in our community, do not be scared to come to the healthcare system if you need care. Go to your doctor's offices, go to your healthcare system. We have learned how to keep everyone safe here and provide safe care for COVID patients, for non-COVID patients. Again, it is probably one of the safest places you can be during this pandemic. So I really do not want to delay anybody to think about delaying necessary care.
Thank you. And there's some specific questions about numbers that have been coming in. Two questions back to back with some numbers. So I'm going to read them out together. The first is that in a New York Times article, there was data provided that showed ICU beds here in Fredericksburg were at 79% use. In the meantime, we've also seen data sets that came out on Monday that shows hospital beds occupied by COVID-19 patients in Stafford County alone is 13% and Fredericksburg at 12%, where capacity experts say anything above 10% is pretty concerning and 20% is extreme stress. Given that, how concerned are we that if someone contracts the virus in any setting really that requires hospitalization right now, that they're going to be able to get the care that they need?
Yeah. We have all sorts, we have a Teams meeting, Eileen can speak on this. We're meeting very regularly with surge planning and making sure that we can care for everyone. So, you know, we're imploring our community to stay safe and keep the curve flat, prevent this exponential growth that we're seeing so that we don't get overwhelmed like we saw in other regions. Our ICU is extremely busy with COVID patients and with non-COVID patients. And, you know, again, the rate limiting step is ICU nurses. There's only so many ICU nurses. There's only so many ICU physicians. There's only so many respiratory therapists with that skill set. So it's not about beds. It's not about ventilators. It's about skilled personnel, highly skilled personnel that is required to care for these individuals. But we are working every day to make sure we can care for everyone. And we have many different contingency plans, surge plans, both at Stafford Hospital and at Mary Washington Hospital to ensure we can care for folks. The data is very difficult. You know, I look at this data too. You know, we're looking at what we really have here in our health system. You know, you just have to understand when the time frame that data was pulled. Is it rolling data? You know, there's a lag in people getting reported data. You know, our data that we're all reviewing is minute to minute. We know what's happening at this second in this healthcare system. You know, so that's what we have to rely on. It's hard to look at what's reported out there.
There's an analogy I like to use because everybody likes to think they can look at a data point and be able to determine whether we're beyond a capacity or not. And it's just not that easy to look at like how many beds do we have in our hospital and then therefore a capacity number, what is within our ability to care for people. And the analogy I use is like we're like an orchestra, like our health system is like an orchestra. And some of our beds are dedicated to things like behavioral health, and other things are dedicated to like mother baby and deliveries of new babies, and there's very specific areas. And it's like an orchestra where you have a violin section and the trumpets and the tubas and the percussionists and the xylophones, right? Everything's a little different, right? And some of those things can cross over and you can build capacity, right? Like maybe a cellist could do a little bit of violin if they needed to. And so you can flex things to increase capacities within the system. There's no exact number you can look at to say, well, we're just stuck at 5. But there are limits to that too. Like you can't take the trumpet player and tell him put a violin in his hand and expect it to work the same way. And so there is flexibility in our system. You can't look at any one number and think you got it figured out, or like, oh, we're past anything like that. But there are limits as well. And that's one of the reasons why we started these town halls again is when you look at the curve we're on with the increased prevalence in our community and how many members of our community are requiring hospitalized care to care for them with COVID, including in our ICU unit, it is very concerning that we might get outside. If it continues on that trend, we're not going to have the violinists we need. And there's only so much you can do when you run out of the violinists. I think it's a fairly good analogy. There is some flexibility within the orchestra to handle things. But, you know, being the leaders of the orchestra here, we're saying, hey, there's some concerns ahead if we don't take action now. And so I'm asking everybody in our community, all those numbers you quoted, they are concerning, right? And they are good arbiters that there are contingency things occurring in our hospital now. but we need to take action to get things back into the control of all the different sections of our orchestra so everybody gets great care and we don't reach a point where we're having worse health outcomes for individuals that need care.
Thank you. And general question for the panelist. What are we working with other hospitals in our region or across the state in planning for how we care for patients and the surge?
That's almost as regularly as we're looking at planning within the hospitals. So each of us are on calls every day with hospitals across the state, across the country. That was very helpful early in COVID because we could talk to places that were seeing outbreaks early and learning lessons from them about what to do and what to not do. Now I can tell you just today, I was on a call with the chief nursing officers across the state. And we even said, what's different about this call is we're all feeling pretty much the same thing. Whereas in the past, it would be different parts of the state where they would say, well, gee, we're really high. Southwestern parts of the state at the time weren't seeing a high COVID while Northern Virginia was. Today, the real difference in our call is that was pretty much a blanket across the whole Commonwealth saying, we're all feeling it, we're all seeing it. And that's what heightens the concern. Because there are limited resources as far as those orchestra, those musicians that we need. And early in the pandemic, when say we could send people, clinicians, nurses, and doctors to New York because that's where the need was. Now the need is everywhere. There aren't enough nurses and doctors that can provide this care, and that's what we have to recognize is different. So the curve has to be flattened. Because you can see that if it continues on the path that it's on, the need could exceed resources, and we don't want to get there.
There's been great collaboration with health systems.
Yeah.
The VHHA and the Department of Health have been great partners throughout all this. We're conversing with them very regularly. It's been very helpful.
Thank you. We're swinging back to another vaccination question. Do we know yet that once somebody receives a vaccination and they hit that 28-day mark that you mentioned with Pfizer vaccine particularly, when will it be safe for them to stop wearing a mask? Or is there still reason for people to continue to be masked and wear PPE?
That's a very important question that I get asked very frequently. Just because you're vaccinated does not mean you stop wearing masks. What will determine when we stop wearing masks is when we get a large percentage of the population vaccinated, we start approaching that herd immunity. The number of cases in our communities across the country start to diminish, and this starts, diminishing. And most pandemics do not leave with like a door shut and you're fine. They usually just slowly dwindle away, and that's what we're expecting with COVID as well. But there's no indication. First of all, 90% efficacy is great, not 100%. So you do not know if you're in that 10%. We also don't know if you could get a lower level infection that you would not even feel if you've been vaccinated, but still be contagious to others. So there's a lot of unknowns even with the vaccine and how this is going to proceed. We know kind of that the immunity lasts at least 6 months. We don't know if it's long-standing, short, or what. So masking and universal masking will continue until the numbers start dwindling off and we get a large number of our country vaccinated.
Another vaccine question that came in, if somebody, as we're preparing for the eventuality of being able to vaccinate high-risk members of our community, should they be preparing? Do they need a letter from their doctor to show that they're in a risk category? Or how do we know yet what kind of proof, if any, they have to show that they're a high risk?
We don't. We have not gotten technical information on that. We have broad categories of risk profiles and our stratification from the state on how we're going to go through this. But we don't know necessarily you're going to have proof of a certain pre-existing condition at this point.
Thank you. And Dr. McDermott, I'd like to pose this one to you. One of our viewers is struggling to understand, given what they say is the extremely low mortality rate for people with no comorbidities, why the lockdowns and general mask mandates are still the preferred approach. And wouldn't we be better off leaving this to the individual to evaluate their own risk tolerance?
Yeah, See, this is the problem is when you an individual says, well, I'm willing to take the risk in my community, I think I'm in a low risk group, it's their risk of passing it on to those that are high risk or to somebody else who will then infect somebody who is high risk. And all of the concept, you know, there were some early concepts and people conceptualizing that perhaps the best tactics are to protect the high risk individuals and let everybody go. Those have all failed everywhere where that has been attempted, right? And so we need broad, widespread community efforts. Every single person plays a role in helping us lower the prevalence of coronavirus in our community so everybody can remain safe, including the high risk individuals. And, you know, saying I'm willing to take the risk, there's lots of things we do with one another every single day to keep one another safe, right? One of those would be, I had too much alcohol and I want to drive my car and I'm willing to take the risk, right? I'm willing to take the risk. Well, you could harm somebody else and kill or really injure somebody else severely by that action. So we don't let you do it, right? And it doesn't even make sense to allow somebody to say, well, it's an individual, I'm taking that chance. I think I'm safe to do it. You could harm or injure somebody else, right? And it's not okay to do. And there's lots of actions like that. Even driving on the right side of the road. You can't say, well, I'm willing to take the risk. I want to drive on the left side of the road. Well, it's not safe. It's not safe to you. It's not safe to others. And it's the same thing with this coronavirus. There are actions we know that we can all take with one another. This shouldn't be political. It shouldn't be controversial. There's science behind it, right? And it's the same thing where people say, well, I don't believe in, like, if somebody says to me they don't believe in gravity, like, okay, I don't care. Science doesn't require beliefs. Science is science. It's the truth, right? And so there's no belief in whether you believe in gravity. Gravity is true, right? If you drop something, it will fall to the ground. Mask wearing works. I'm not going to ask if you believe in masks or not. The science is in. Mask wearing works, and it will lower the prevalence of coronavirus. So I implore everybody to recognize the science, look at it, understand it, and then let's take action based on that science to keep our community safe, right? In lots of ways, we need to keep our community safe and take action right now.
Yeah, and it's also, you know, the law of percentages. You know, people, I hear this very uniformly. Look, I'm not in a high risk group. You know, I have a 99% chance of getting better, so I don't really care. I'm not going to stop doing X, Y, or Z. But when you look at, say, if there's a 1% mortality, you think, oh, that's low. But 1% of hundreds of millions of people in this country is still millions of deaths. And it would completely overwhelm our healthcare system and ability to care for anybody for anything. So even these small numbers would completely overwhelm and create absolutely unacceptable levels of mortality and death in this country. So, you know, even when you think 1%, it still is a major amount.
Yeah, the 1% sounds like a little amount. It's a huge risk. 1% is a huge risk, right? If you had to roll a dice every day, a 1 in 100 dice, and you had to roll it for 100 days, I don't think you'd like that. I don't think you want to roll that 1 in 100 dice for 100 days, right? Not good odds there, right? So let's recognize these risks sound small. They're actually very large. You know, a 1% serious illness rate from a virus is extraordinarily large.
Going back to vaccination and preparation for that seems to be a hot topic tonight on the chat. How are we going to be determining the tiers for our healthcare workers? The question is, there's many questions in there. How are we determining who's high risk as a healthcare worker? Is that a personal risk or occupational risk? And is it hospital versus community healthcare workers? And are we prioritizing Mary Washington employees over others in the community? Can you speak to that?
These guidelines have come out from the CDC, and there's an advisory panel guideline, and then our state has seen those guidelines and has also formed our state's guidelines based on those guidelines, and they involve, for healthcare workers, they involve those who are caring for patients who have COVID-19, those who are caring for patients at high risk of COVID-19, others that need access to clinical facilities that might be caring for COVID-19 patients. And there are different gradations and categories that are worked down to prioritize the healthcare workforce based on based on their care of COVID-19 patients, high-risk COVID patients, or being in facilities that have COVID patients, and then the remainder of the healthcare workforce. So different categorizations that help prioritize who would get the vaccine first. I do think with some of the good news is the availability of vaccines, and a lot of we don't have any vaccine here currently, but a lot of the numbers that have been talked about that are likely to be available even within these first 3 weeks. By far the large majority of the healthcare workforce in our Fredericksburg region is going to be able to be immunized within the next few weeks. And that's great news. It logistically takes about that long to do it anyways. There are just logistics involved with administering the vaccine. But the good news is there should be availability enough to handle the highest risk groups prioritized by those CDC guidelines adopted by our state, hopefully within a relatively short time frame.
Yeah, and the difference between private and I don't know if Eileen, you were going to talk about that, but the difference between the private physicians and employed, and we're following the state guidelines, and we intend to facilitate vaccination of our entire medical community, whether they're employed by Mary Washington Healthcare or not.
And remember, a healthcare worker is not just a doctor or a nurse. A lot of people think that, but the highest priority group are environmental services and janitorial staff that are involved in cleaning those rooms and helping assist the teams on the floors. There's a whole host of our workforce. It's not just the clinical teams, but anybody who works and is involved on those floors that is at the highest priority to receive these vaccines.
Yeah.
Eileen, did you have something you'd like to add?
We also expect the state to be monitoring that we are administering the vaccine following that prioritization. So we've taken a lot of time just in the last 2 days trying to make sure we understand what that prioritization is, and just looking at our own employees and associates to make sure we understand who that would be and who it would not be. But I think, as Mike said, the best news is that the reassurance that we're hearing is that once we start getting vaccine, we expect that we'll continue to receive it. So we'll be able to hopefully pretty readily expand through each prioritization group.
Great. Now, what about people who are concerned about an allergic reaction to the vaccine? How would they get information about what's in it and how to prepare whether they could potentially have a reaction to it?
Yeah, I believe that is all being released here today and in the next 24 hours as the FDA makes its ruling. So we will have that information hopefully here shortly and be able to share it as appropriate.
Great, thank you. Can we talk a little bit about what kind of long-term symptoms some of our patients might be experiencing after having COVID?
Yeah, there are a large subset of individuals who have this and do have long-standing issues of all sorts, from respiratory problems, ongoing fatigue, kind of cloudiness or fogginess with their thinking, ongoing headaches, and also a long, prolonged lack of sense of taste or smell, or sometimes not even the lack of it. Things that normally just taste or smell great to you will taste or smell putrid. And that can go on for months and months. So there is a subset of what they're calling long haulers with COVID that are really having very long, prolonged symptomatology. And we don't have a lot of understanding of that at this point, or what their expectations for getting better are. Another reason to protect yourself.
We've also seen people that had COVID, had very mild cases, and weeks later come into the hospital with blood clots. And only through having seen, once we treat them for the blood clot, come to find out that yes, they were positive for COVID a month or two before.
That's a catastrophic complication of COVID that people aren't talking about too much, but people can get better from the respiratory side of things and then die of a blood clot. Or come in, we're seeing that in the healthcare system frequently, strokes, and different things. So that is very serious.
Some of our viewers are saying that it almost sounds like things are kind of okay then, and that there's not much they should be worried about as the vaccine starts coming out. And is there potentially fear mongering happening in the community? Can we touch on that?
One thing I want to talk a little bit about, and I have another analogy for you. I don't know why I'm using all these analogies tonight. But the vaccine, it is a great, I mean, it is some light at the end of the tunnel. But I think of it like a fire and a hose. Okay, so the vaccine is a hose, and it's going to help us put out the fire. Well, a hose is best used if you have a fire that has maybe a little bit of smoke and a tiny little flame over here, right? And you can use that hose. The vaccine will be helpful in squashing the flames. If you have a small hose and you have a forest fire, which is what we have right now with the prevalence of coronavirus in our communities, with records being set every day at local, state, and national levels, the hose only does so much good if you have a forest on fire in front of you, correct? So we have to take tactics right now to lower the prevalence in our community so that the vaccine increases its effectiveness and allows us to tamp down and keep it at low levels, right? So the hose is only so effective in the midst of a forest fire. You'd rather have a small little smoke and a little bit of flame and have the hose available, because then the prevalence can go to zero in your community, and then we can all get back to more normal lives, right? But it's not where we're at today. And so I'd still rather have a hose than not have a hose in the midst of a forest fire. But the prevalence, where we have too much fire right now, and we have to take these tactics to reduce the fire so that our hose is more effective.
Thank you.
Best case scenario, the next couple months are going to be very, very difficult. Even if we get a very significant amount of vaccine and there's a great adoption rate, people are getting the vaccine in the community, we have months ahead of us of a very difficult time.
Thank you. Is there a minimum age requirement for the vaccine? Do we know?
I think the Pfizer one, what they just approved, the advisory panel just voted before we came on today to recommend approval of the vaccine to the FDA. The FDA needs to act on that. But I believe it says for individuals age 16 and older. Okay. But don't hold me to that one. It was right before we came on here.
It's breaking news, and we'll have to let the news handle that. Yeah. We have gotten a lot of questions about school district and kids going to school, kids being on school buses. We don't tend to respond to how local communities take care of things outside of our hospital system, but I thought I'd put it out there that we are getting a lot of questions about the safety of kids returning physically back to school. And there's a lot of school districts that are starting to look at hybrid or return. Is this something we can comment on, or?
I mean, my comments would be, we all want all of our children to get back into that educational learning environment of school because of its effectiveness in teaching and learning, and it's so critically important. Schools play a big role as well, just socially, the way we're set up as a society, and everybody wants schooling and education, the education system, to get back to what we are used to and we would consider normal. The things that we can do to make that happen are the actions that we've talked about earlier, right? We need to have very low prevalence of this coronavirus in our communities in order to safely accomplish that. And so it's another reason why when everybody says, gosh, I want schools to get back to normal, like, well, that's great. If that's your motivator to wear a mask at all times, stay at home right now. If you can stay at home, don't be around others. If you're around any other person, you should have a mask on. Whether indoors or outdoors, and try not to be in those environments where you need to be around anybody outside of your daily household right now. Those actions are going to allow us to decrease the prevalence in our community again, where we can start talking about ways where we can safely reopen the schools and feel like we're doing it in a responsible manner.
Okay, thank you. And some of the another question about hospitalized patients. What is the most common reason people end up hospitalized with COVID-19, and what are the common treatments for those that are in the hospital?
Most commonly, patients are coming to us with respiratory problems, with breathing problems. So maybe a pneumonia, and the respiratory complications. That's most commonly presented, and in certain cases, they can get very sick very quickly. And so we see them come into the hospital, and then in a very short time, some do end up in the ICU and on mechanical ventilation. So it's mostly the respiratory conditions that we see, the patients that come in with difficulty breathing, pneumonia. But I'll let Chris talk about sort of some of the treatments that we're using that we've had great success with.
Yeah, a lot of the treatment is supportive. I think steroids given in the right time frame for the right patients have been shown to give a lot of benefit for individuals. But something called proning that we talked about back in the spring, where people roll from their stomach to their back to kind of continue to help aerate and open up the lungs. Delayed going on a ventilator. So we're using high flow oxygen in people who have very, very low oxygen levels, who historically we would throw on a ventilator and use a mechanical machine to help them breathe. We're finding that those individuals with COVID do better on the high flow oxygen and delaying the requirement for a ventilator, because that pressure from the ventilation can do damage to the lungs over time with COVID, which makes the lungs very stiff. Some of the other treatments, we still, in some cases, use convalescent serum to kind of boost the immune system. Lukewarm effects from remdesivir and some of the others. So we are using all these different treatments, but there is no silver bullet at this point. The best treatments we're seeing, as I spoke earlier, are the monoclonal antibodies, but those are for people before they get to the level of a hospital. It's really a lot of basic and supportive care, supporting people through sometimes very prolonged hospitalizations as their body slowly heals and their lungs heal from the COVID.
Thank you. Do we currently allow visitation for positive COVID patients? Can you talk a little about visitation, Eileen?
Sure. So we've actually just the week of Thanksgiving did cut back on our visitation policy in our hospitals. And so our policy right now is, by and large, for our COVID patients, we are not allowing visitation. And that is really as a way to protect our staff, protect the other people that may be in our building, and to make sure that we have the resources to care for patients. Now, certainly there are some exceptions to that limitation on visitation. When we have children that are pediatric patients, we've had a very small number of them as COVID, but we do allow parents to be with them. People with disabilities that need to have a caregiver with them, we certainly allow that. Again, we try to limit that as much as we can, just because of the risk of transmission of COVID. When we have patients that are at the end of life, and when we've been in those situations and families want the opportunity to see their loved ones, we rely on our patient care team, our nurses and our doctors that are caring for these patients to make those decisions, so that if loved ones need to be able to see their loved one in some fashion, we'll make those allowances. So it's definitely been more restricted since Thanksgiving week, and that's because that's when we saw the numbers start spiking and going up. And so we still have those in place. I know, Lisa, we're part of a team that looks at visitation, and we're hoping that we can put a system in place where we can sort of color code and to make it easier for the community to know we're at level green, and what does that mean? And we're at level yellow, what does that mean? We're at level red. I don't see us getting to anything that would look like a level green for quite a while, because we really need to see those numbers of prevalence in our community, as well as the number of COVID patients in our buildings really drop way significantly from where they are now.
It's another good reason for a call to action, right? I mean, we have to take these actions and tactics to limit visitation to make our facilities safer at a time when the virus is so prevalent in our community. We need to keep our staff safe. We need to keep all of our patients safe that are under our care. So we have to take these steps. But nobody wants to be in the position where we have to limit visitation. So, and I don't think everybody out there can probably relate to, like, if they or a loved one needed health care right now in a hospital, you'd like to have a loved one with you or have support with you, right? So if we take tactics right now to lower the prevalence in our community, we can have more visitation for those patients in our community that require hospitalization right now. That is a good thing. We want to be in that position. We can't do it right now because the prevalence is too high in our community, and we need to keep our facilities safe. But it leads to that unfortunate circumstance for those patients that are hospitalized where they can't see their loved ones as much as they would want to. And I think everybody understands that. Everybody's been very understanding of our reasons why, but it's still an unfortunate set of circumstances. And we can take tactics right now to help make that better.
Right. Thank you.
I can ask the entire Facebook Live team out there, please repeat the tactics for me that we can take, right?
Wear a mask.
Wear your mask, right?
Wash your
Stay
hands.
in your home,
Wash your hands.
right? Wash your hands. Social distance.
Social distance. So can someone get COVID twice?
Yeah, it's happened. Yes. There are individuals that have had COVID twice where their immunity has not been lasting. And so there's uncertainty there. And, you know, we've only been dealing with coronavirus here for a matter of months. And so there is a lot unknown about it long term. Nobody can know what happens in the coming years, or even the long-term effects of having had it or been hospitalized from it. Like there's a lot of unknowns still out there, but there are individuals that have had COVID-19 more than once.
The couple of last questions before we sign off for the evening. Do we know yet any of the anticipated side effects of the vaccine? Have they been released yet?
Most of them are immune response reactions, which are a good thing, right? It shows that your body is, hey, it's mounting an immune response to the protein, and those are good things. And so things like maybe having a little bit of a fever, a headache, very minor symptoms. I think in one of these vaccine trials, nobody was sick enough to miss a day of work from receiving the vaccine. So the side effect profile is relatively mild, and what you would expect, and actually in some ways hope for mounting an immune response to help you into the future. Chris, you can add to that.
Yeah, the only other thing I'd really want to stress and point out is this is not a weakened virus that we're giving people like many vaccines could be. This is a protein, so the protein can't make you sick with COVID. You hear over and over again the myth of I got the flu shot and it gave me the flu. That is physically not possible, scientifically not possible with these COVID vaccines. Most of the symptoms are from the immune response, which again is a good thing. That shows you're mounting a response.
And do we anticipate that this will be an annual vaccine over time, or do we even know yet if it'll be something that we build immunity, like get it once in our lifetime and a booster later?
We don't know. Only at this point is what I'm hearing is that it's shown to have 6 months of immunity, but I think time will tell. These are questions we have answered.
I think the reason they say that is because the earliest people to receive the vaccine are 6 months out.
Yeah, right.
They still have immunity. They still have antibodies. So it's just we don't know.
But we do know it could get us that window of time that we need to start putting down
Absolutely
to get that herd immunity. Okay.
Yeah. I'm very excited about the vaccines, the data coming out. They've been very transparent with all of the data. That FDA advisory panel today was live streamed all day. Anybody who wanted to listen to it or watch it all day, it was extremely transparent with everybody. You could watch the entire thing if you'd like to. And so the data looks very good. The safety profiles look outstanding. It's very effective. I'm very bullish on these vaccines. They look very, very good. When it's my turn and time to receive one in the prioritization list, I can't wait to receive it.
Yeah.
One final question from our community, and then we'll wrap up. This is a good one, and I appreciate it. What can our community do to support our healthcare workers other than staying home, wearing the mask, and all of the things we're telling them to do? Is there anything that they can do? Can they donate? Can they support our healthcare workers in some way?
Yes, and certainly, and that's always well received. I will tell you that back in the early days of COVID, the things that were most heartwarming to our healthcare heroes were the actual small things that people did. So I can remember one day when we had a parade of cars from a neighborhood came through the campus. I mean, I still get choked up just thinking about it because they were there, or walking into work or walking into the parking garage and seeing the parking lot all filled with chalk messages or signs at the entrance to the parking lot saying healthcare heroes or thank you. So the donations of meals and is great, and that is greatly appreciated. But I would even say, and it was going to be part of my closing message, if you know a healthcare hero that's working at a hospital during COVID, say thank you. Say thank you for the work that they've been doing tirelessly back since March of this year, and also say thank you to their families. Because that's really who are also heroes, because their loved one who is working in our hospitals comes home to them every day, and that's where they get their rejuvenation and their support. And so it is the small things. So if you know a healthcare provider that's working in a hospital, say thank you, do something nice in your neighborhood, honk your horn when you walk by. It means a lot. It really does.
Thank you, Eileen. And I'd like one last plug that I'd like to put in. We talked about convalescent plasma a little bit earlier. We had received news from the American Red Cross just this week that the convalescent plasma donations are not keeping up with demand now that we're seeing such a significant increase in hospitalizations across the country. So anyone who has had COVID-19 and has fully recovered may have the antibodies to be able to donate their plasma. So we do recommend, if you've had a positive COVID test historically and have recovered, please reach out to the American Red Cross to be considered for a plasma donation. So Dr. Newman, closing thoughts.
Again, I think there's a lot of room for optimism, as we've discussed tonight. New, very effective treatments to prevent people from getting seriously ill, new vaccines. So there's a lot of cause for optimism, but that does not mean, as of right now, that we should take our foot off the gas as far as being safe and protecting our community, protecting our healthcare system, protecting our healthcare workers. I think realistically, we're going to be into the spring before all said and done, and brighter days start showing ahead. We've gone this far, we're close. A lot of reason to be optimistic, but we do have to stay safe. It's very disappointing. Here we are at the holiday season. Usually just love gathering with friends and family and coworkers, but this is not the time. I'm Irish, and I'm going to say I'm hoping we're going to have a fantastic St. Patrick's Day. We're going to delay all that celebration for a whole year to March, maybe, if we're lucky, or maybe even later. But I think we have to celebrate the holidays creatively, and we have to be safe.
Thank you, Dr. McDermott. Closing thoughts.
My closing thoughts. I just want to thank everybody who's taking the time out of their evenings to join us for these Facebook town halls. And even if you're somebody who's watching this maybe a few hours later or maybe tomorrow, if you've made it to this point of the broadcast and gotten through the whole recording, I want to thank you for your engagement in this. You're the individuals, everybody who's here now listening to us at this point of the conversation, who are really able to make a difference in our community. And so my ask of you will be to poke 1, 2, 3, 4 others that encourage them to maybe watch this video as well, or encourage them to take action, and encourage them to talk to 2, 3, 4 others to take action as well. It's that sort of messaging and cascading that we need now to really have it be effective in our community to help us flatten the curve again.
Thank you. And thank you to all of you. I appreciate your time that you're giving to our community each week. Thank you to all of you tuning in tonight to our community town hall. We want to put up a number here on our screen. If you are having symptoms and you are not sure where to seek care, you can call our Mary Washington Healthcare free triage line. Our HealthLink nurses are available daily from 6 a.m. to midnight to talk with you about your symptoms and offer care advice. They can be reached at 540-741-1000. And just a reminder that the Rappahannock Area Health District is hosting free COVID-19 testing. Visit their website listed here on our screen to register for one of their free screenings. And finally, Mary Washington Healthcare and our expert panelists will be back next week on Thursday, December 17th at 6:30 to update you once again on the latest news and information on COVID-19. So please join us next week as well. And as we continue through the holiday season, we ask that you please stay safe and healthy and have a good night.